Good day, Dr. Mel and classmates. In this video, I will present my evaluation framework for ACSM programs. Allow me to start by saying that monitoring and evaluation are all about measuring and understanding experiences, whether these experiences are represented by quantitative or qualitative data sets. And when we talk about measuring the experiences of people from implementing content and programs, we have the tendency to react rather than to listen, a behavior that can be attributed because of urgency or even because of the need for compliance. I turn to the concept of listening, specifically social listening, as a central feature of my evaluation framework. In its original definition, social listening is the tracking of the reach and impressions about a topic, program, or brand across social media sites and other online platforms. As a digital analytics tool, social listening is looking after the number of likes, mentions, and conversations about a particular content or social issue. For social and behavior change communication, social listening enables programs to scan what is being said on social media, to analyze sentiments behind messages and campaigns, and to use this information for program design and adaptive management. What is social listening compared to the traditional social monitoring? Monitoring is a reactive plan in scanning what's going on with our tactics and therefore is intended to gather information. Monitoring is essentially looking at the present and the past. A key question in monitoring activity is how often do people talk about the social problem? A type of question that signals the measure of frequencies and effects in the more objective world. Listening, on the other hand, is proactive at, as it is aligned with strategy and how all possible forms of monitoring data can be used to provide insight. If monitoring looks at the past and present, listening looks forward with both past and present. A sample question in social listening can be, how do people talk about the social problem? A question that signals the collection and analysis of multiple realities and contexts surrounding a particular problem. Why I am focusing on social listening? While originating in social media analytics, social listening can be used to evaluate social change programs intended for populations that are deeply immersed and highly engaged with social media. This has been proven by the study, for instance, of Sharon and Company, where they found that social media behavior on Instagram influences environmental attitudes and practices. Moreover, most or if not all ACSM programs of any group or organization have online or social media presence, which are utilized because of their reach, cost efficiency, scalability, and performance. Given these conditions, I define social listening as integrating online social media indicators and offline conversations such as interviews, stories, and narratives from fieldwork to evaluate the impact of an ACSM program. In my view, social listening is or should be broader in accommodating voices that supplement traditional data gathering for impact assessment. My framework also uses the concept of conduits. It is important to note that social listening and social media rely on circuits to ensure the desired flow of program or to ensure that the desired flow of program is achieved. Conduits are channels that allow the transmission and performance of phenomena or an experience. Conduits serve as a catalyst that precipitate an event or change. We can also look at conduits as the roads or as roads to a tipping point where we want to see the change to happen and to be followed by more people. Social media are some of the world's most popular conduits for social change and is a good fit for evaluating conduits or evaluating ACSM programs. Taken together or taking these elements together, I propose the social listening conduits for monitoring and evaluating ACSM programs. It is inspired by the socio-ecological model where the target audience is at the center, surrounded by layers of agents from the intimate and familiar to the influential and mandatory. My version of an SEM slash conduit ME or MNE framework is composed of the social listening target in the middle, and surrounding it are three types of conduits. The policy conduits, or basically the functions of advocacy at the national or international level, and also essentially in the macro perspective. The persuasion conduits, or the functions of communication at the individual or at the micro level. And the power conduits, or the function of social mobilization at the community or meso level. Again, the model that I'm proposing employs both online and offline assessments. Policy conduits specifically refer to monitoring and evaluating the impact of all channels that enable the design and implementation of legal frameworks or legal support. Persuasion conduits refer to all or refer to monitoring and evaluating channels that promote the adoption of a particular change or a particular behavior. Power conduits refer to monitoring and evaluating all types of assets and resources that can strengthen and amplify capability to achieve the desired results. The social listening conduits framework combines the predictive ability of quantitative analysis and the plausibility of qualitative inquiry. It is iterative as it allows the monitoring and evaluation of each circuit with equal attention in space, giving both opportunities for data and stories to emerge. This way, insights can be developed as intended through social listening, greater and beyond the traditional social monitoring and evaluation. The social listening conduits framework combines the predictive ability of quantitative analysis and the plausibility of qualitative inquiry. It is iterative as it allows the monitoring and evaluation of each circuit with equal attention in space, giving both opportunities for data and stories to emerge. This way, I am happy to share with you my evaluation of Group Three's project using the social listening circuits model. The Group 3 campaign is designed to promote a healthy workplace for millennials with a focus on avoiding hypertension and are based on the nuances of the demographic involved. It is a very relevant project as hypertension among millennials is a silent phenomenon affecting so many, including or especially digital laborers in the BPO industry and the millennials in general. Good health certainly should be a non negotiable item in our list of personal and social priorities, especially after all that we've learned in the pandemic. After all, health influences the productivity of the people and eventually the entire nation. I would like to first commend the clarity of the project by isolating millennials as the target audience. ACSM programs that target the millennials or those who were born between 1981 to 1996 recognize the character of digital natives who consume social change information on personal mobile devices. Millennials are also the largest cohort in the Philippine population and are often described as digital natives who grew up with mobile computing or computing devices and services, particularly the internet. According to Content Science Review, 20% of global millennials spend more than 20 hours every week on their phone, and this project could actually optimize that particular engagement by segmenting or disaggregating the audience to personas so that it could identify more nuances within the population or within this cohort. This way, they're all, or they will be also be able to clearly target specific lifestyles or lifestyle segments within the millennials, and especially those who are very active in different types of workplaces. In terms of policy conduits, the project emphasizes the role of power structures and authorities that design, implement, and or change legal frameworks. I think it could employ broader multi-sectoral efforts of the government, for instance, on policy, uh, that they can repeal laws allowing electronic smoking or regulating working conditions. The Department of Labor and Employment can also review occupational standards and require BPO companies for regular and sustained employee wellness program as part of the registration and renewal processes and standards. The Department of Health, Philippine Health or Philippine Heart Association, and private sectors can also integrate programs that go beyond random cardio exercise or mental health activities to produce what we call integrative and participatory approaches to employee well-being. In terms of the persuasion conduits, the group's use of social media to target millennials is a good alignment decision. As I mentioned earlier, millennials are very much engaged with social media, so the matching of social media consumption and targeting of them in this particular program is a wise decision. The group's use of the health belief model also emphasizes agency, urgency, and perceptions that precede health practices. I think the choice of the theory signals that the campaign and the group basically had a sense of matching appropriately uh, theories on message direction and message design. The project, I think, could be improved by defining and operationalizing social media e-health literacy, which there are literatures about it online, and which is basically cross-optimizing social media channels to promote health education. The Group 3 campaign is also commendable for its for aligning uh, with the credibility principles of World Health Organization's effective health communication, but it could also be improved by one, including expert voices to counter approach echo chambers, credibility corrosion, fleeting awareness, and artificial urgency that are prevalent on social media campaigns. The same expert voices can be used on media channels specifically for content consumed by the target audience. I would say, or I would recommend including testimonies and guide posts that could make health literacy content and practices more reliable, more accessible, and more doable. Lastly, the power conduits of the campaign would bring us back to policy actors and other proactive contributors, assets, and units that can strengthen the program's capabilities and capacities. The Group Three's campaign clearly synergizes human and material resources from baseline sources to actual implementation and implementing actors or co-actors. But it could also harness more sectors in both commercial industry and development work to contribute in my vision of strategic health promotion that again optimizes social media and other channels, and that could benefit both the commercial industry and development work sectors in the long run. Overall, the group has a straightforward approach to an urgent health problem, which is hypertension among the younger population. It also matches the profile of the target audience with a communication strategy driven by the power and reach of social media that is aligned, or that is very much aligned with the demographics online media consumption. And given more time and planning, I think the project could satisfy the full spectrum of policy, persuasion, and power conduits in monitoring and evaluating ACSM programs. That's my evaluation of Group Three's project. Thank you very much.